Ladies, I'm busy now. The meeting is at 10 o'clock.
Well, that wasn't a very good start, was it? Have we done something wrong?
I don't think he realises how unfriendly he sounded. Frankly, his tone makes me feel a little bit nervous about this meeting. How about you?
Yes, I feel nervous too, and actually I find it difficult to say what I want to say when I feel like this, and I wanted to speak calmly and thoughtfully in this meeting.
Yeah, I agree. And feeling nervous and weak is hardly accepted at our level.
No, you're right. But I do feel weak and worried, and I don't want my new boss to see it.
Sandy, I really admire your honesty. And you know, how we feel can really affect this meeting. Well, our feelings and attitudes bring an unseen reality to the situation. And I really don't think Mr. Charles is aware how our feeling nervous can affect the meeting.
I guess he's the boss and the one who makes the rules.
But I wonder what we can do to support each other.
Well, maybe you could be the external eye, the meta-communicator, like the detached observer.
Okay, I'll try.
I'd just like to find the strength to participate fully in this meeting without being afraid.
Well, why don't we take a closer look at the fear? Go ahead and notice what it's like to feel afraid.
Okay.
What do you notice?
Well, I feel a cold breeze blowing and it touches my skin, and I can see that the breeze brings a big cloud and it stays right above the top of my head.
And is the cloud alone, or are there other clouds?
It's just one big one, and it's like a big cotton ball.
Yes.
And it's surrounding me.
You're smiling.
Well, all of a sudden I feel like I'm in a big cotton ball, and it allows me to jump inside and take my feet off the ground.
Okay.
And I can move within the cloud, and it feels safe and comfortable.
And can you say anything else about this?
Well, it feels relaxing. I can step in and I can step out. It's like I have the freedom to stay more involved and the freedom to detach.
Wow. So how do you think this quality can help you in our meeting?
Well, I guess this allows me to be flexible. It helps me to get another perspective and able to get involved or detached. Makes me feel like I have a choice.
Good.
Hello there.
Hi, Mr. Charles. I'm Helen. Nice to meet you.
Nice to meet you. Come in.
Hello, Sandy.
Hello, Sandy. Nice to meet you. Please, sit down.
Welcome to the hospital, Mr. Charles. It's
Thank
nice to meet you.
Thank you.
We're very happy that you're here.
Yes, welcome, Mr. Charles. We're really looking forward to working with you. In fact,
Sandy and I have had a lot of work on our shoulders. Our hospital has suffered big cutbacks to our public funding, and we really need to work very hard to have the hospital we want for our city.
Well, hello to both of you. Thank you for coming. As you know, I have been appointed as the new general manager of the hospital, and I've been hired to improve the hospital's economical situation. Let me be frank with you. My background is in law, but at the last hospital, I was made responsible for managing the restructuring of the costs of the hospital to make it a more viable business proposition. And now here at this hospital, my new project is to start improving the efficiency as soon as possible. So my first step will be to meet with all the different area managers in order to do an assessment that will help me to develop an action plan. Basically to make the profit and loss account look healthier.
Well, I think that's great that you have the vision to start building good relationships.
and that you value the people here. Not all new managers see the work that has been done before as valuable.
Well, yes, of course. Building relationships with the people that we'll be working with is important. Perhaps more important is how they will deliver the expected results.
With a good relationship in place, the results will be more positive.
For example, right now, the relationship between the three of us is very important.
It will be a reflection of how well we work together.
Yes, I mean, that's true.
I think it would be useful if I could explain in another meeting how we programme the work of the 300 nurses that we have on our staff. I would particularly like to share with you how we organise the weekly distribution of the days off. Also, I can explain how we manage sick leaves. It's one of the most challenging management issues.
Yes, I'd like to know not only how you do it, but also to look at the costs. Cost containment should be the drive of the management philosophy until we reach a healthy economic situation at this hospital.
Yes, I understand your point. Although I really agree on that, I must say that we need to be aware that we are pushing our nurses to the limit. They are taking the night shifts when needed in order to cover absences and sick leave. The law doesn't oblige them to do this, but because I maintain a good relationship with them, they do it. I believe in teamwork and try to maintain close relationships with my team. This is the only way that the work in the hospital can be done without much higher costs. Imagine if we had to hire more nurses to cover the shifts. We'd be bankrupt.
Well, I mean, Sandy, I have worked in a hospital before. I mean, is this the way you manage the whole team of 300 nurses? I mean, maybe you should consider doing it in a different way. We don't manage our business through relationships. Maybe you should help her with the numbers so she can understand better the global situation. If we don't show the value in our numbers, there is no value at all. No one will invest in assets that are not profitable, and this is not affordable. We need to make the hospital attractive for our investors. There is no future otherwise.
We're having a conversation with two different viewpoints.
One that values numbers and the other relationships.
The way I see it is that both viewpoints are valid.
Well, I'm trying to be clear with Sandy so that she can see other ways to work. I mean, this is always going to open up new ideas.
You're right. It's necessary that we're open to new ideas.
I'd also like to comment on our experiences with the chain of command at this hospital. We've always had great success with positive management, so that the staff feel valued and are motivated.
We've always put great emphasis on this here, and I feel it's the only way to encourage the staff to work at their full potential under sometimes difficult circumstances.
Well, I'm glad that you have had a positive experience here, and I'm open to hearing about your experiences. I'm sure it will make my job a lot easier.
Well, I think it's great that you can and are willing to talk about this.
It's not always easy. I know we're dealing with different perspectives here. Conflicts can easily escalate later on if we don't deal with them appropriately when they arise.
I'd like to build on what we're discussing. We're all people with feelings and with a basic need to be respected. I know how hard these nurses work. They work because they feel committed and valued. They work because they care about the hospital.
That's all very well and good in theory, but now action needs to be taken. Helen, show her the numbers. In the end, if an organisation doesn't come up with results, relationships are not important anymore. I mean, I find it hard to understand how this hospital has been running the loss with no action taken to prevent the losses from escalating.
Yes, I can see that.
I'm sure it's not easy for you to understand the former management
Of a hospital in so much financial trouble.
I have to say, I feel a little uncomfortable with what you're saying. I feel it's important that you know a little about our past general director and his managerial style. He was a doctor and very devoted to the medical profession. He stood up politically for public health, and the majority of our patients come from the public health system, from which we received funding. As a result, we are well known for providing some of the highest quality care and services available anywhere in the public sector.
Yes, I worked very closely with him. And he would say, we need to stand for our quality. We need the confidence of the people in our city. We need to be a reference hospital to the public system. And it's the excellent quality of our doctors and patient care that has got us our professional reputation.
But maintaining this course is simply too expensive. Are they the best doctors simply because they're the most expensive? If we don't cut back, we are finished. All our decisions should be ruled by the need to have a profitable hospital. If not, this hospital won't survive.
I strongly believe that what has been done needs to be respected, and I think you're expressing your ideas in a way that underestimates all the professionalism of the previous management.
I am not interested in the past. We have to put our vision into the future. The past only prevents us from evolving and growing. I'm sorry, Sandy, the way the hospital was managed in the past is not sustainable.
I see how much passion and commitment are present from both of you.
These are very passionate statements, with great willingness to move the hospital forward, Mr. Charles.
Well, yes.
And your passion, Sandy, well,
It shows how much you've fought to get the present.
nursing service under such difficult financial conditions. Mr. Charles, can you say anything else about how you feel?
Well, I'm someone who doesn't need very much, but I like to do my job right. I like to prepare for possible problems. I don't like to improvise because I don't like to leave anything up to chance.
Can you imagine for a minute
What it would be like to improvise. I know this is an unusual request, but I think it might be really useful for the three of us just to
get to know each other better?
It's not the way I usually do things. Deal with situations. Fate is fate, and it can often take you where you don't want to go.
Yes, I understand. And when facing fate or uncertainty, numbers don't often help.
Well, I guess not.
Sandy will tell you that she's not really a numbers person, but she's very good when dealing with unpredictable situations.
Well, I appreciate you pointing that out, and I'm glad that Sandy has those skills. But walking into the unknown is not really what I relish, I must say.
Well, Mr. Charles, thank you for saying that. I must stand for all the work we have done. Helen, myself, all the medical doctors and other staff in this hospital have gone through many changes over the last 17 years. And I've worked hard to achieve the results regarding service and quality and to build what we have now. We've faced many situations that were not planned or expected. We've had to negotiate with public health patients in order to get greater public funding, and every year we've had to adapt internal services depending upon the expected number of patients. You know, I can also relate with what you said before. I've not been involved with the economical parameters of the hospital. We were funded publicly and our results were not measured in terms of profitability. It was our General Director who maintained the political relationships with the Public Health Administration, and the fund that the hospital received were managed internally by the holding company. And Helen is right. I'm not a numbers person. I do rely on other skills.
Well, that's very brave, Sandy. But there are a diversity of skills necessary.
Well, maybe profitability was not key before, but now it is mandatory. Our management needs to be totally involved. And you're right, relationships and personal influences are important. But the type of management based on relationships needs to be integrated with a results-orientated management. And we need to find ways to track and report results so that we can celebrate our achievements.
I really see the importance that you're giving to the control over economic results, and I understand that the financial results are key to the success of our hospital. Maybe adding up the financial results will allow a business approach that we haven't had up until now, due to the fact that we were funded publicly. I'm sure Helen can help me to build a way of following up and controlling the important economic data. And maybe you can help me with some other ideas you have to address my area of responsibility.
Oh, this is a nice way to anchor our teamwork.
Yes. Well, this has been a good meeting. Thank you both. Let's schedule another meeting with you, Sandy, to go over the coordination you have with the nursing team. And Helen, you should get the figures in order to analyse different alternatives. Good.